3, 2, 1. Good to go, ma'am.
Okay. So shall I start presentation?
Can you start, sir?
Shall I start or should I wait?
You can start now, ma'am.
Okay.
Ma'am, before that, a short introduction, please.
Okay.
So, good afternoon, everyone. On behalf of Cardiogem Division from Alembic, I warmly welcome participants today. Volume Matters webinar. Today's topic is lifestyle tips in hypertension management. Now, I am pleased to introduce our speaker, Dr. Seetha ma'am, who will guide you on simple and practical lifestyle measures for better BP control. Thank you, ma'am. Thank you for joining us today. Over to you, ma'am. Thank you.
Good afternoon, everyone. I'm Dr. Seetha, interventional cardiologist practicing in Chennai. Thanks for the opportunity. So we'll go for the presentation. Okay, my slides are seen. Yeah. So today's topic for discussion is about lifestyle changes to be made in hypertension. So, understanding the volume and the blood pressure. Excess salt intake increases the body fluid volume, and this puts an extra work on the heart, and this leads to high blood pressure. As you can see from the slides, when there is an excess salt intake, that leads to fluid retention in the body. This increases the blood volume, and this in turn increases the workload on the heart. This leads to increase in the blood pressure. So controlling salt intake and the body fluid becomes essential to protect our heart and manage our blood pressure. So about the recommended BP targets, we should know that our blood pressure is under control, and where the target is achieved. So why we need to achieve the target for hypertension is that it will prevent us from having the end organ damage. So it will reduces the complications associated with the hypertension. So if the blood pressure is high, we call it a silent killer. It itself will not affect the symptoms or anything. So it will silently induces changes in the other organs in the body, like it will target the kidneys and it can lead to kidney disease. It will target the heart. It can lead to coronary artery disease or cardiomyopathies associated with the hypertension. So to prevent these complications, we need to address the blood pressure, and we need to keep it under the control. So the target for blood pressure is like less than 130/80. This is the target, and especially in patients with chronic kidney disease and cardiovascular disease, the target is slightly on the lower side. So whenever the blood pressure is high, we have to consult the doctor, and we have to get their advice whether we need to go for lifestyle modification or we need to go for any medication, so that we can maintain our BP target. So what is the lifestyle modification that we need to follow to keep our blood pressure under control? We need to follow DASH diet. What we call in DASH, it's a dietary approach to stop hypertension. So what are the recommendations in the DASH diet is that we have to eat lots of fruits and vegetables and whole grain. And this will provide with all the required vitamins, minerals, and fiber in the body. As we can see from the picture, we have to take a lot of greens. We have to take whole cereals. We have to take, and we have to take all colored fruits. This will increase the vitamins and mineral content. And we have to choose in the dairy products, fish and the poultry. We have to choose which has low fat and which is having high protein content. we have to take milk, we have to take fish, and we can take nuts. We have to choose what we have to take from this, and what we need to reduce. We need to reduce red meat, any sugary drink, and sweets. These things we have to reduce. By reducing this, we can reduce the calories, we can reduce the trans fat, we can reduce the carbohydrate level, can reduce the sugar. And the unhealthy fat we can reduce by avoiding red meat, pastries, chocolates, and stuff. And we have to get enough of minerals like potassium, magnesium, calcium, and fiber. We have to choose the diet that contains all these healthy supplements, and this will keep our blood pressure under control, and this will help us to maintain the overall health. So adopting to the DASH diet is a very simple and effective way to manage blood pressure and to protect our heart. So reducing salt. So we just by saying reducing salt, the patient will not know how much they can take. So the general recommendation is to reduce to almost 5 grams per day, limit your salt intake. So this can significantly reduce the risk of heart disease, especially in people with high and or difficult in controlling the blood pressure. This will play a major role. And we need to avoid the processed and the fast food, whichever comes in a packed form. We need to avoid. We have to avoid high calorie foods like burger, pizza, and aerated drinks. We need to avoid, and we have to use potassium rich salt alternatives if advised. So in the you take a less salt today, you'll have a healthier heart tomorrow. Stay active. We have to advise them for everyday active exercises. So regular physical activity will help us to lower the blood pressure and improve the overall heart health. What we advise is an aerobic exercise in the form of walking, jogging, or elliptical, treadmill, or even swimming. Everything we can do. We'll advise a minimum of 30 minutes every day. So in put together, we'll advise almost 300 minutes per week activity is good for us. So aim for at least 30 minutes. If you go for at least 60 minutes per day, it will be good enough. So we have to be more active, and we have to avoid sedentary lifestyle, working long hours in the system. These are the things that is leading to heart disease. So if we sit less, we can have an healthier heart and lower blood pressure. We have to keep our stress levels less. So managing stress through yoga or breathing exercises or meditation, these can help us to lower the blood pressure, and this can improve the overall well-being. So we have to know how we can manage stress. We can advise the patients on following some kind of hobby, whichever they are interested in. If they are interested in art, if they are interested in some craft activities, or if they are interested in dance or sports activity, we can ask them to follow their hobby, which can reduce the stress levels. We have to take care of as we are already discussed. We can advise them to have a good health diet that will reduce the blood pressure. As we have already discussed, we have to eat a diet which contains a lot of fiber, all green leafy vegetables and whole grain. We have to advise them, and we can ask them to increase the probiotic in the diet in the form of yogurt. We can advise them to take probiotics, and also we can advise them to cut down the excess salt and saturated fat and food which is processed. All these things they can avoid to improve the overall the gut health. Coming to the healthy habits. So we have spoken about the diet, we have spoken about the exercises and managing the stress level. Along with that, we have to advise the patient to avoid alcohol. So alcohol itself will directly may increase the blood pressure. So we have to ask them to reduce the alcohol intake as much as possible. So we have to advise them after the following lifestyle changes. Again, if the blood pressure is not under target, and you have to consult a doctor, and you may be prescribed medication. So as and when required, if your blood pressure is high, you have to get it checked. And whenever medicines are prescribed, you have to be compliant with your medications to have a better control. And we have to avoid smoking, quit smoking, and also avoid energy drink, because these are the things that will raise the blood pressure, and in turn it can increase the risk of stroke or increase the risk of heart disease. We have to avoid aerated as well as sugary drinks. We have to avoid, because they can have an negatively affect the blood pressure and the heart health. Thank you.
There is some question in the chat box, madam. You can
Okay,
that answer.
fine. Yeah. I don't see any questions. It is there.
Actually, I have seen in the viewers link. Just a minute.
If you can read out for me, I can proceed.
Yeah, just a moment, ma'am.
Yeah.
Bonish, question படிக்கிறீங்களா மேடம்க்கு?
Once again, sir. Madam, the first question is, can BP become normal only with lifestyle changes without medicines?
Definitely yes. So we have to strictly follow the lifestyle changes as advised. We have to go for salt restricted high potassium diet. We have to go for regular walking exercise, and we have to advise them on what are the diet we need to take. Lifestyle changes are good to start with. It depends upon how much target we are aiming at. If the patient is having a BP of 140/90, the target is only 10 millimeters of systolic and diastolic. These can be tried with dietary changes and exercises. So lifestyle changes can bring down blood pressure by say about 10 to 20%. So we can get the blood pressures done based upon how high the blood pressure is.
Okay, ma'am. The next question, how much salt should I take daily if I have high BP?
So the general recommendation is like less than 5 grams of salt per day is the general recommendation. You have to restrict your salt intake to less than 5 grams.
Which Indian foods should I avoid to control BP?
So about I think we have discussed a lot about diet. Overall, what I say is take lots of fruits and vegetables. Avoid red meat. We have to avoid. We can take fish. We can take chicken in a limited quantity. We can take, and we can take eggs. We can take milk. All red meat we need to avoid. All deep fried food, whichever is deep fried, we need to avoid. And we need to avoid pickle, puppet. These are high salt content food. So dry fish, pickles, puppet, whichever is salted, whichever comes in a packed form, everything will be mostly with a preservative and salted one. Those things we need to avoid.
Okay, another question. What type of exercise is best for BP control, and how much should I walk daily?
Okay, so minimum recommendation is 30 minutes per day. So if it is good, if you can go for 60 minutes. So minimum is 150 minutes per week to 300 minutes per week is good enough for blood pressure. Not only for blood pressure, for a general health, we have to advise them for 30 to 60 minutes per day. And what kind of exercises? Even a good brisk walking, jogging, swimming, so badminton. So these kind of exercises are any kind of aerobic exercises we can advise for patients with blood pressure.
Another question, ma'am. Does stress and tension really increases blood pressure? How can I control it?
So stress is one of the risk factor for blood pressure, and this in turn is a risk factor for heart disease or stroke. So if we need to control our stress, we can advise the patient to follow some kind of activities like yoga, meditation, or we can advise them to go for some regular hobbies they can follow to reduce their stress levels. So eating healthy, and another thing I need to add is a continuous of at least 6 to 7 hours of good sleep. This again will reduce your stress levels.
Is
Ma'am,
tea or
actually,
coffee
ma'am,
harmful?
yeah. You continue, Bonish.
Is tea or coffee harmful for patients with hypertension?
Yeah, high caffeinated drink can increase the blood pressure. We cannot say it's harmful. We have to say we have to limit the quantity. Limit the quantity of sugar in that drink, and we have to reduce the content of caffeine. So these indirectly can increase the blood pressure.
Ma'am, actually, one more question, ma'am.
Another,
எக்ஸாக்டா இந்த பிபி சரியா பரிசோதிப்பது எப்படி எந்த நேரத்தில் பார்க்க வேணும்னு சொல்லிட்டு கேட்டிருக்காங்க. Which is the correct time, ma'am?
So கரெக்டா பிபி பார்க்கணும்னா அட்லீஸ்ட் we have to be பேஷண்ட் வந்து கண்டினியூஸா ஒரு 30 minutes வந்து நல்லா ரெஸ்ட்ல இருந்துட்டு அதுக்கப்புறம் ஒரு சிட்டிங் போஸ்டர்ல we have to check the பிபி. சிட்டிங் போஸ்டர்ல we have to tie the பிபி cuff at the level of heart. நம்ம டேபிள்ல வந்து நம்ம ஹேண்டை வச்சு அதுல வந்து நம்ம பிபி கஃப் கட்டி ஆஃப்டர் 30 minutes ஆஃப் ரெஸ்ட் we should not have done வாக்கிங் அந்த மாதிரி எக்ஸசைஸ் எதுவும் பண்ணாம 30 minutes ரெஸ்ட்ல பிஃபோர் தட் we should not take any hot drinks. ஸோ காஃபி அந்த மாதிரி ட்ரிங்க்ஸ்லாம் எதுவும் எடுக்காம in a sitting posture at the level of the heart நம்ம அந்த apparatus-அ வச்சு we have to check the blood pressure. We have to check at least 2 BP readings 10 minutes apart. Check பண்ணிட்டு we have to take an average of it. So that will be the best way to go for the home BP monitoring.
Okay, thank you, ma'am. One more question, ma'am. பிபி வந்து நார்மலா வந்துட்ட பிறகு இந்த மெடிசன் ஸ்டாப் பண்ணலாமா இல்ல கண்டினியூ பண்ணலாமா?
So generally BP medicines வந்து we need to continue. So once நம்ம medicines திருப்பி stop பண்ணோம் அப்படின்னா திருப்பி BP will shoot up again. So it depends upon the patient requirement and also the clinician who is seeing. So generally you have to continue the BP medication unless advised by your doctor to stop the medicine.
Okay, ma'am. Ma'am, in case, ma'am, இன்னொரு கொஸ்டின் இந்த ஊறுகாய் அப்பளம் அந்த பேக்கேஜ் ஃபுட்லாம் இருக்கு மேடம், அது அது எந்த அளவுக்கு மேம் வந்து நம்ம
அதை மென்ஷன் பண்ண பிக்கல் பாப்பட் இது எல்லாமே வந்து நம்ம ஜெனரலா டயட்ல இன்க்ளூட் பண்ணக்கூடாது. அது எல்லாமே வந்து ஹை சால்ட் கண்டென்ட் தான். So we need to avoid it as much as possible.
Okay. Thank you, ma'am. Bhuvanesh, any question, Bhuvanesh? You received?
yes, ma'am. வீட்ல இருந்தபடியே அவங்க பிபி செக் பண்றதுக்கு கரெக்டான டைமிங், ஐடியல் டைமிங் எதனா இருக்கா அப்படின்னு?
ஐடியல் டைமிங்னா மார்னிங் அவங்க வந்து ஏர்லி மார்னிங் பிஃபோர் பிரேக்ஃபாஸ்ட் அவங்க செக் பண்ணிக்கலாம். அதே மாதிரி ஈவினிங் வந்து பிஃபோர் ப்ரீ டின்னர் நம்ம செக் பண்ணிக்கலாம். நான் ஏற்கனவே சொன்ன ப்ரிஸ்கிரிப்ஷன் பண்ணலாம். அட்லீஸ்ட் 30 minutes கம்ப்ளீட்டா ரெஸ்ட்ல இருந்துட்டு நம்ம செக் பண்ணணும். நம்ம எங்கேயாவது வாக் போயிட்டு வந்துட்டு ஏதாவது ஸ்ட்ரெயின் பண்ணிட்டு வந்துட்டு நம்ம பிபி செக் பண்ணோம் அப்படின்னா அப்போ பிபி வந்து ஹையா தான் இருக்கும். ஸோ அதை பேஸ் பண்ணி நம்ம பிளட் ப்ரெஷர் ஹைன்னு நம்ம டிசைட் பண்ண முடியாது. ஸோ கம்ப்ளீட் ரெஸ்ட் எய்தர் ஏர்லி மார்னிங் பிஃபோர் பிரேக்ஃபாஸ்ட் ஆர் ப்ரீ டின்னர் நம்ம பிளட் ப்ரெஷர் செக் பண்ணலாம்.
Okay, ma'am. Thank you so much, ma'am. That's all the questions, ma'am. So thank you so much for your valuable guidance, ma'am. And I also thankful all patients for joining today's webinar and making this session successful. So thank you, everyone. Thank you so much, Doctor. Thank you so much.
So thank you
so much, ma'am.
Thank you.
Ma'am, we can end the session.
Okay, sir.
We can end the session, sir.
You can stop the live. लाइव स्टॉप्ड ना जिगेश?
Stop the sir.
Yes, sir.
कितना काउंट हुआ फाइनल काउंट?
64, sir.
नहीं हुआ था. Okay, thanks. So we can log